Okay, so now we're doing manual muscle testing of the finger flexors and extensors. All right, so first we're gonna start out with a 3. So we're just gonna ask him to flex his fingers. That's a 3. Now we're gonna go back, and then we're gonna ask him to do a simulate a 2, which a 2 is a partial movement. And then we're gonna now ask him to simulate a 1, which is where he's almost no movement, but I can still palpate. The contraction of his trying to move. And then a 0 would be his fingers would just be flaccid and can't move at all. Now we're gonna bring it to here, and if I try to peel away his fingers, but there's no break, that's a 5. And if he breaks a little bit, that's a 4. That's it for the wrist or the finger flexors. Now we're gonna do finger extension. So we're just gonna ask him to extend his fingers right now. That's a perfect looking 3. Now I'm gonna ask him to simulate a 2, which is partial motion. So partial, that's like a partial movement. And then now I'm gonna palpate back here and ask him to simulate a 1, which is where he can't really do the motion, but I can still feel his extensors attempting. And then a 0 is where his fingers just are dangly loose, don't do anything. Now we're gonna simulate the 4 and 5. So I'd be pushing down on his PIPs, and I'm gonna ask him to extend. And if he doesn't break, that's a 5. If he breaks a little, that's a 4, and that's it.